Okay, so the first topic we are going to talk about today, guys, is the metabolic plateau. The metabolic plateau, or the dreaded weight loss plateau. This is that all too familiar process in which we have probably experienced many times in the past, where we started a weight loss program and experienced a slowdown in the rate of weight loss, and then eventually probably hit a full on plateau where the weight loss just stopped. And that's a scary place to be at, because you're exercising more, you're eating less, and you're not getting weight loss, guys. So we need to understand the mechanics of it. And so we're going to get into that, guys, in this talk. We're going to talk about the science of a plateau and things to consider during a proper reset. All right. Why does a plateau happen? Well, if you think about it, a plateau is an evolutionary adaptive response. And so if our body didn't do plateaus, we wouldn't have survived that well during times in the past where actual periods of starvation and lack of food could happen, right? We don't experience that anymore. We live in a society with a constant, easy supply of food. But back in the day, ancestral times, it was a very real possibility of not getting food. And so this is strictly a survival mechanism at its greatest, and it's quite powerful. And it does have profound effects at keeping you alive during times where there's a lack of food. And so how exactly is it happening? It is a cascade of changes through various hormones in your body. But on the upper end of it, we have changes in leptin, right? So what is leptin? Leptin is like a checks and balances. Your fat tissue produces leptin in reaction to fat increase or fat decrease. And so as you are gaining weight, as you are gaining fat, leptin levels increase to then communicate to a certain area in your body called the hypothalamus, which then detects the higher levels of leptin and goes, okay, great, we need to burn off some of this extra weight. And it does that by making changes to both your hunger and your metabolism. And so when leptin levels go up, you will become less hungry and your metabolism will speed up all on its own. It's freaking great. Now, on the other side of it, during starvation, during consistent weight loss over time, leptin levels decrease. And so this is what we've experienced, right? Is our hunger increases and our metabolism decreases. Now, what's interesting to understand for people suffering with high amounts of insulin resistance and obesity is that we do find high levels of leptin in their body, high levels of insulin too as well, which is why we understand now at this point, leptin resistance alongside insulin resistance are part of the culprits going on in obese patients, because their body is literally in starvation mode when it's not, which is why there's this like button in the background being pushed, which is causing consistent weight gain. It's because, again, your hormones are all messed up, and we have plenty of other videos talking about the hormonal basis of obesity and difficulties losing weight. Okay, so in practicality, I have seen and worked with patients, especially some of our patients in the program now, who I start working with them and I find out that they're eating less than 1,000 calories a day, which is pretty wild. So everybody has what's called a TEE, or a total energy expenditure, which is your basal metabolic rate, how many calories your body burns at rest alongside your activity level. And so there's calculators online that you can do to estimate what your TEE is. But generally speaking, somewhere between 1,800 to 2,800, depending on whether you're a lighter female or a heavier male, gender, weight, age, all are going to play a factor. But seeing somebody who is eating 800 or 900 a day is pretty wild. But what's pretty genius of the body is it could last off of a caloric intake that might even be more than a 50% reduction. And what's even crazier is the literature shows that you'll actually live longer. Some of the longevity studies have shown that when you commit to eating a huge reduction of calories for the rest of your life, and it would get easier presumably over time, right? you'll live longer. But the way that you live longer, I like to call it battery saving mode. Nobody wants to be in battery saving mode. When you have a laptop and you put on battery saver, what happens? The screen shuts off a lot faster. The laptop doesn't perform as fast. It's very annoying, right? Well, with your body, in battery saving mode literally means you're not thinking as clear, you're not thinking as fast, your brain's not getting as much energy. Nowhere in your body are you getting the amount of energy that you were getting, which is why you live longer. But you could lose your hair, you could have all sorts of various responses, again, keeping you alive longer, but because it puts you in battery saving mode. So that's not a place that you want to be, no matter how cool it might sound to live an extra 15 years. You don't want to live in battery saving mode, guys. Okay, so am I in a plateau? Now, these 5 categories are going to sound a little bit redundant to each other, but it's important because many people get excited when they start a program and they want to overlook this step, right? Like, I don't want to wait another 3 to 5 weeks, which is the average amount of time it takes to fix this, because you're so excited to start the program. But you can't overlook this. You have to be able to identify it and perform this cycle, this activity, in order to have strong, consistent weight loss afterwards. Okay, so the 5 different categories are this. Number 1, the obvious, prior weight loss. If you've lost weight recently and you are no longer losing, or you're losing less, then you are in a plateau and need to reset. Number 2, you've been on GLP-1 medications like semaglutide and tirzepatide over a period of time. I have yet to find any patient who's been on a GLP-1 medication and not in need of a reset. Those medications are freaking powerful, and nobody is really instructing the majority of these patients on how they should approach food. So they come to me, I've seen over the years, in a severely reduced caloric state. They are eating so much less because that's what the medications do, and that's what caused the weight loss for them. But a lot of them come to me in a plateau because they've been eating so much less and the body triggered this survival response. Because remember, if your body didn't do this, you would die faster in a real starvation situation. Number 3, I've lost weight a while ago and I've been stuck. This one's interesting because there are patients that'll say no to prior weight loss because they lost weight 2-3 years ago and they literally forgot, not so much that they forgot the weight loss, but they didn't realize that they've been stuck in a plateau for 2 to 3 years because you get so used to it, right? What they would probably realize if they thought about it is that they used to eat more prior to losing 10, 20, 30 pounds, and they probably experienced weight gain when they started eating more, and they had enough mental strength to commit to eating less, and they've been doing it for years. And so I've come across that as well. And so it's important to identify that as well and the need for a reset. Number 4, being in a caloric deficit. Maybe you never lost weight. Maybe you reduced your calories, but your body's resistance was so powerful and so fast. You probably lost a couple pounds, but it was so insignificant that you didn't even consider it weight loss. But when we look at your total amount of calories, you're eating a lot less than what you should be eating. And so you are in a plateau, which is, I know that sucks, guys, to be in a plateau after not having lost weight. It's so wild. I see patients sometimes where they lost a couple pounds and bam, their body plateaus, and other patients who are lucky enough to lose 100 pounds by essentially calorie restriction over time, because that's the mechanism that drives this, right? And they're lucky enough to where their body doesn't plateau right away. There's all sorts of reasons that we don't fully understand why that plateau can happen so quickly or not. But in any case, it doesn't really matter because you're there and we got to fix it. Finally, the 5th category to consider would be the presence of low thyroid symptoms. What are low thyroid symptoms? Increased brain fog, decreases of energy, obviously difficulties losing weight, hair loss, brittle skin and nails, constipation, achy body, intolerance to cold. You don't have to have all these symptoms, but if you have half or more, then you have low thyroid symptoms. Specifically, if you can pinpoint the beginning of these symptoms starting at some point after your prior weight loss, then we can likely make the connection that the low thyroid symptoms are a result of the plateau that you created with prior changes in your intake or prior weight loss goals. It's important to understand that because you can have low sex hormones or low thyroids for so many other reasons. In fact, that's one of the treatments that we offer in our clinic. But in any case, if we can pinpoint it to after the weight loss, your low thyroid, which we would probably test on blood, is actually due to this, and we could fix this with just eating more and not so much necessarily getting on thyroid hormones. I'll have other webinars talking about whether you should get on thyroid or not. Okay, so what happens when you fix with a reset? It's like getting out of battery saving mode, guys, and getting into high power mode. And we want to be in high power mode. Don't let the idea of high power mode scare you. And I know for some of you that I've personally worked with, especially if you were really on the extreme side eating 1800, and now I'm trying to get you up to 1800, and it seems like twice as much food, and you've gotten so accustomed and so used to eating so little that you're thinking, I don't even want to eat this much food. But trust me when I say you do not want to be on battery saving mode. You got to get into high power mode, because high power mode is normal. That's how you should be thinking. That's how you should be functioning. You want the maximum amount of energy going to your brain. You want the maximum amount of energy going to your organs so that you can live life at its highest potential. And we can't do that in battery saving mode. So we gotta fix this. And more importantly, the other reason is not just for the sake of being out of battery saving mode, but if you want to hit your weight loss goal, you can't do it in battery saving mode. We got to get to high power mode, because all weight loss to a certain extent is going to produce some amount of plateau, but we're trying to prevent that. So we want to get to the highest point. I like to call it metabolic power. Okay, so how do we do the reset? Well, in essence, the summary of the reset, simply stated, is a slow increase in calories over time till we hit the ceiling. So let's break that down. What do I mean by that? We need to start by assessing what our prior caloric intake has been, like a daily average, over the past couple weeks. Now, if you've counted calories before or you're counting calories now, easy enough. You know exactly where you're at, right? Take that number and compare it to the total energy expenditure, the TEE calculators that you can find online. Increase your initial number by 100 to 200, and every single week increase that. And we're going to get into that in a second. But a lot of us have not been counting calories. A lot of us have no clue what we've been eating. And so this is where we're going to have to start what I like to call a calorie counting experiment. Now, the counting calorie experiment, because as you know, I don't like making people count calories because it sucks, it's awful, it's tedious, and quite frankly, it's a waste of time in most cases. This is an exception. It is very important to know how many calories you're consuming for an effective, smooth reset. So you can go on to apps like MyFitnessPal. There's plenty of tools, but start the experiment over the next week. Look at what you're eating, so that way you can then make an assumption of what you've been eating, so that you can estimate to the best of your ability what has been your daily average. Once you figure out what the daily average is, you want to add anywhere between 100 and 200, and that's going to be your goal for week number 1. You're going to take this reset in weekly increments. Every single week, you look back at the prior week, make an assessment, things are good, increase it again. And you're going to keep doing that till you hit the ceiling. What is the ceiling? Because that's the goal of this. The ceiling is that I've hit the maximum amount of calories that my body can consume without considerable weight gain. And obviously this gets very potentially finicky and details matter, but for the sake of this video, this is going to be the guidance that is going to be enough for most people, and most people won't need anything additional than just following what we're talking about here. So how do we confirm week by week that we're progressing positively? Those weekly weigh-ins, guys. So you look at your weight and you go, okay, compare it to last week. My weight stayed the same. Fantastic. Think about that for a second. If your weight stays the same and you ate more, that means your metabolism sped up. Now, what's pretty wild and awesome and exciting is when patients tell me, oh my gosh, I'm losing weight. I wasn't losing weight, and now you're having me eat more, and I'm losing weight now, which is freaking wild and exciting. Either way, there's no way to predict what's going to happen. You're either going to stay the same or you're going to lose weight. Those are positive signs. The other sign to look for is a potential improvement in those thyroid symptoms. This is where I very much recommend keeping a weekly log so that you can look at last week and look at this week and make a comparison. So no changes in weight or a loss and or improvement in symptoms means you're good to go, and then you increase your calories to the next week. That is how we know we're progressing. And then the ceiling, right? The goal is hitting what we think and estimate to be the ceiling. And again, those calculators, although those calculators online tend to overestimate, I tend to find them 85% of them somewhere between 1,700 and 2,600, like I said. The lighter side being a lighter female versus a heavier male. It doesn't need to be an exact science. We just want to get somewhere in that range so that we're out of battery saving mode. We feel a heck of a lot better. We're in a point of metabolic power, and then we're off to the races for our weight loss. Okay, so things to consider. Keep your fasting to intermittent, time restricted. So obviously this is the FLOA Protocol and you're super excited to dive into the long rounds of fasting, but we want to be careful because long rounds of fasting is similar to caloric restriction. I have a separate video where I talk about the connection between caloric restriction and fasting. So we want to be careful. We don't want to tap into that, especially if we're in a plateau. So keep your fasting to intermittent, meaning like a daily shortened window of eating. Number two, keto can be very helpful. And so I strongly recommend we go keto during the reset because we want to keep insulin levels lower and we want to minimize any fat gain during the reset. Number three, should I stop my GLP-1 medications? Well, I've seen it work in both scenarios. Me personally, I recommend to stop, and I think you should stop, but I also don't want to produce a great deal of anxiety. And I've noticed with patients over the years, telling them to stop their medications or educating them so that they can make a decision whether they should stop or not, because they have to have that conversation with their primary care physician, as I'm not their doctor prescribing these medications. Ultimately, it's their decision. And when you are doing a reset, the idea here is consuming more calories. And so artificially suppressing your appetite kind of goes against the whole point of what we're trying to do. And for some people can be almost damn near impossible because the GLP-1 is suppressing their appetite so much. So talk to your prescriber, whether it's with us or somewhere else, and make a decision. If they're okay with you stopping during the reset, that's how I would approach it, because it gives you a break. You can become a little bit less resistant to it, have a appreciation for what hunger feels like again, what the natural cues are supposed to be like before you get back into a state of artificially suppressed appetite. All right, so the final thing to consider is what it looks like to be eating at your TEE. You need to have, this is so important to have an idea of what that looks like, because a lot of you are going to go back onto the GLP-1 medications and back to very likely under eating. And I don't want you having to counter calories every single day for the rest of the program. So if you can do some sort of mental note, some sort of checks and balances with yourself to remember what eating 1,800 calories, 2,000 calories looks like, it'll make it easier for you to keep it consistent, because again, fasting for 48 hours does have some crossover. It's a short-term caloric restriction. And so if you fast for 48 hours and then undereat from your TEE, then you can re-hit that plateau. That's actually some of the strategy of what we're doing, is we are alternating periods of feasting and fasting. This is what the human body is made to do, is fast and feast. Now, obviously, when you're looking to lose weight, the balance is in the side of more fasting and less feasting, but it's the presence of some feasting which tells our body that things are okay, and to attempt to kind of hack it to not creating that plateau again. So even if you overeat on one of those days, that is completely fine and recommended, but make sure you hit your TEE. And having done this during the reset gives you a great amount of appreciation for what that actually looks like. Okay, great. So that is the reset, guys.